Telangiectasia is one of the most common skin conditions for which patients seek laser treatment. The main areas of cosmetic concern are the face and the legs. If we firstly look at the face, or the head and neck region, the dual yellow offers all of the laser parameters necessary to treat these dilated superficial veins with maximum efficacy and a minimum of side effects. The spot size of 0.6 millimeters targets the range of most telangiectatic vessel sizes with minimal impact on the adjacent skin. The exposure time in tens of milliseconds allows thorough vessel coagulation with sufficient perivascular heating for permanent obliteration, but below the threshold for scar formation. Most importantly, the yellow wavelength is ideal for selective absorption by hemoglobin. The desired endpoint of treatment is immediate vessel disappearance without whitening of the skin. The laser parameters are chosen for facial telangiectasia. The energy may be altered during treatment according to the visible clinical response. This video demonstrates the non-contact vessel tracing technique. Note that the handpiece spacer acts as a guide to maintaining the lens at an accurate distance from the skin, thereby maintaining the spot size. It is also desirable to keep the handpiece as perpendicular as possible to the skin surface. To perfect the vessel tracing technique, the operator should watch the laser spot on the skin rather than looking at the spacer tip. Here we see an example of optimal energy selection. Treatment should continue until all vessels have been obliterated. There is no harm immediately retreating a vessel which is not blanched, although care should be taken not to pulse stack. A useful hint when treating sensitive areas like the nose is to rub the skin between pulses or to use an ice pack. This reduces the typical hot pinprick sensation. Most laser treatment of telangiectasia is tolerated easily without any form of anesthesia. This video shows residual whitening of the skin, at which point the energy should be reduced. Whitening or blanching of the skin, which does not immediately disappear, denotes protein denaturing, and this can result in hypopigmentation. Immediately after treatment, the skin becomes diffusely erythematous, which lasts for an hour or two. A feeling akin to a mild sunburn may persist for about the same time. Where a large number of telangiectasia or very large vessels have been treated, patients may experience some swelling for a couple of days. It is also possible to see some flaking or tiny superficial crusting for about 3 to 7 days. An experienced dual yellow laser therapist should be able to offer a patient the expectation of 75 to 90% reduction in facial telangiectasia in one treatment. Exceptions occur with active or florid rosacea, systemic steroid use, and darker skin types. Nasal vessels respond well, but are prone to recurrence, which is a feature of the pathology and not a failure of the laser. Overall, the dual yellow is a safe, excellent and well-tolerated laser for the successful eradication of face and neck telangiectasia. As with all medical procedures, however, results improve with operator skill and experience.